All right, welcome back. Latest research shows that Arkansas has the highest maternal mortality rate in the nation. There's a lot of attention on this right now, and people are going to try and change these numbers. So joining us this morning to kind of explain what this is and why it's happening is Baptist Health OBGYN Dr. Brian Burton.
Good morning.
So hello,
Thank you.
Have you here.
Glad to be here.
You deal with babies and mamas all the time.
Yeah,
so
absolutely.
Do these numbers surprise you? First of all, what is maternal mortality? Let's talk about that first.
So this is a good question because this is a huge topic, right? I hear about this from my patients frequently. And this includes moms who become pregnant up until a year after they deliver their baby. And so that is the death of a woman within a year of giving birth to her child.
Okay.
That's the data that's included in this information.
And we are the top in the nation for this issue?
It's really disheartening as an OBGYN when we feel like we provide good care and yet we see that we are absolutely failing these moms as a state. And it's regional, and there's some definite factors that contribute to this.
And what are those?
So first of all, understand that 80% of these deaths are preventable, right? And so that's super important. If you are a black woman, you're 3 times more likely to die than white or Asian or Hispanic. If you have low access to care, right? So we see that women in the eastern part of the state, in the Delta, that have Medicaid are more likely to die than other women. If you're over age 35, these are the major risk factors. So. Right, so what do we do about that, right? We can't change women who are having babies later. We can't change that.
Can't change the color of your skin.
No, can't change the color of your skin.
Some people can't change where they live.
No, they can't.
So what do you do?
The things you can do are, 1, be healthier when you get pregnant, right? Control obesity to some degree. That makes a huge difference. Black women have a problem with heart disease in pregnancy. Mental health is a massive contributor to this data as well. We see that depression and domestic abuse, these are big factors contributing. The other thing that we can affect is access to care. Almost 2/3 of these women who die have Medicaid, and currently Medicaid doesn't cover this time frame. And so we need access to care by providing Medicaid to some of these patients, for sure.
After the baby is born, because what happens a lot of times is the baby's born, everything's great. Not necessarily.
Not at all.
Not for hardly a lot of women.
If you've had a child, you know that those first few months afterwards are very trying.
So is there, on a positive note, if people can get to a level of care in time, then the outcomes are better.
Absolutely. Not to say they're fine, but they're way better. Right? If you have a relationship with your OBGYN, then you can reach out at any time. If you have a doctor, if you have a support system, it plays a massive role in that.
Wow. So, very eye-opening. Thank you.
You're welcome.
All right, that was Dr. Burton. Thanks so much for joining us this morning. And you can contact Baptist Health by going to baptist-health.com or calling the health line at 1-888-BAPTIST.